Here we are again. This is continuation of care of special populations. I will talk about battered individuals and victims of abuse or neglect. This is the second to the last video from this chapter. So healthcare professionals are often the first point of contact for victims of abuse or neglect. Females are affected more than men. Older clients, children, and the sequelae of abuse or neglect include physical, somatic, psychological, behavioral, sexual, and pregnancy-related effects. Child abuse consequences are long-lasting, and this type of individuals are at risk for maltreatment. The majority are victims of neglect, maternal, socioeconomic status, and parental behavioral issues impact a child's risk, especially those who are from birth to 1 year of age. Victims are prone to certain health effects as a result of the abuse or negligence. These effects can include bruises, sprains, or broken bones, chronic fatigue, shortness of breath, muscle tension, involuntary shaking, changes in eating and sleeping patterns, sexual dysfunction, and fertility issues. Mental health issues can arise, including post-traumatic stress disorder, nightmares, anxiety, uncontrollable thoughts, depression, low self-esteem, and alcohol and drug abuse. Feelings of hopelessness, lack of worth, apprehension, discouragement, inability to trust others, questioning spiritual faith, and lack of motivation are common. Children who witness violence are prone to fearfulness, anxiety, depression, and problems in school. So healthcare professionals need to consider treating victims with compassion and respect. Acknowledge and respect the dignity of each person. And it may be necessary to take photographs of injuries for legal reasons. Nurses are mandated reporters of domestic violence and abuse incidents. Cleaning and dressing wounds, administering pain medications, use of assistive devices such as for sprains or fractures. Education for self-management and seeking safety and emotional support may be needed in the care of these victims. Provide parental education and support programs and increase awareness of potential child maltreatment. Next is single parents. Women are usually the single parent. Single parenthood places individuals at increased risk for disability and resultant poor health later in life. These individuals may be living in poverty and may be less likely to have health insurance coverage. Children may also be afflicted by health problems when raised by a single parent. Single parents are at increased risk for cardiovascular events, mental health problems, and overall increased mortality. Children growing up in a single-parent household may be at increased risk for dropping out of school, be idle in school, have lower grade point averages, have lower aspiration for higher education, and experience poorer attendance in school. I'm sorry for Rodeo. She's barking again. Rodeo, quiet please. Okay, healthcare considerations for single parents. Access to community organizations can assist in alleviating some burden and provide needed services, such as childcare, food security, healthcare, including immunizations and employment. Assist single parents with a child of the opposite sex to address a child's sexual development. Preventive screenings are important in this population due to risk factors and the negative effects of stress from single parenting. Foster children. As a result of childhood adversity and trauma, this population is at increased risk for health problems later in life. Needs that often go unmet for children in foster care include physical, mental, behavioral, and dental health. They are at increased risk to have complex health conditions, including asthma, diabetes mellitus, food allergies, seizure disorder, organ transplant, HIV, immunosuppression, renal disease, congenital diseases, cystic fibrosis, prematurity, and those requiring assistive devices and technology. Other conditions may include dental problems, eating disorders, encopresis, enuresis, and mental health concerns. Healthcare professionals need to consider among this population community resources to facilitate the provision of health, safety, stability, and permanency. Social workers should be included in the care of a foster child to facilitate access to community resources. Medically equipped homes may be needed, as well as in-home nursing care services. Frequent health visits may be needed for children transitioning from foster care to home. Here are the mental health concerns for foster children. ADHD, attention deficit hyperactivity disorder, aggressive behavior, anxiety disorder, bipolar disorder, depression, mood disorder, PTSD or post-traumatic stress disorder, reactive detachment disorder, sleep problems, personality disorder, prenatal drug and alcohol exposure effects. Individuals with mental illness. Lifestyle choices, disease processes, psychotropic medications, and limited access to healthcare contribute to a shorter lifespan. Many clients with mental illness do not receive preventive screenings. They are at increased risk for cardiovascular disease, metabolic disease, nutritional problems, musculoskeletal disease, sexual dysfunction, pregnancy complications, and obesity-related cancers. Obesity is linked to lifestyle factors in this population, such as a lack of exercise and poor diet, as well as features of their illness noted as depression or disorganized thought processes. Side effects of psychotropic medications may contribute to an altered health state. Certain psychotropic medications can contribute to weight gain. Metabolic syndrome is prevalent among clients with schizophrenia. Clients with schizophrenia, schizoaffective disorder, and bipolar disorder have a higher incidence of diabetes mellitus. Side effects from psychotropic medications such as sedation, weight gain, and increased appetite contribute to the incidence of diabetes mellitus in this population. Diabetic ketoacidosis is more prevalent in those with schizophrenia, and it may be due to an interaction with psychotropic medications. Cardiovascular disease appears to be higher in individuals with major depression, bipolar disorder, and schizophrenia, and is associated with greater morbidity and mortality. This may be associated with excessive sleep, lack of exercise, and poor nutrition. Coronary artery disease, cerebrovascular disease, and sudden cardiac death occur at a higher rate in those with schizophrenia. Due to the higher frequency of substance abuse, risky sexual behaviors, and lack of knowledge regarding risk, individuals with mental illness are at increased risk for viral illness, particularly HIV and hepatitis. Respiratory diseases are more prevalent in individuals with mental illness, including tuberculosis, pneumonia, and COPD. Cancer risk is higher due to lifestyle choices, medications, and comorbidities. There is an association with low bone mineral density and osteoporosis development in individuals with schizophrenia, schizoaffective disorder, major depression, and bipolar disorder. Sexual dysfunction can result from mental illness as well as the medication used to treat it. Obstetric complications can occur in women with schizophrenia. Dental health tends to be poor in individuals with mental illness. Xerostomia from reduction in salivary gland flow due to medications can result in difficulty maintaining oral hygiene and overall health. Health considerations for individuals with mental illness. Due to lack of insurance by many individuals with mental illness, they have a difficult time accessing needed healthcare services. Family and social service support are important for these individuals. Government insurance has expanded to cover individuals in need of mental health care. Mental health screenings should be completed regularly for all individuals, which allows for prompt and accurate treatment strategies to prevent further health complications. Older adults. Elder abuse is a concern for this population. Healthcare providers are mandated to report if there is suspicion of elder abuse. The most common type of abuse is neglect. Some healthcare problems that occur in older adults. This include Alzheimer's disease, arthritis, cancer, dementia, depression, diabetes mellitus, falls, heart disease, influenza, obesity, oral or dental health problems, osteoporosis, pneumonia, poverty, respiratory diseases, shingles, and substance abuse.